Hello, I'm Dr. Michal Regev, and I'm a registered psychologist and registered marriage and family therapist in Vancouver, British Columbia. I wanted to tell you today about a client of mine whose name is Linda. That's, of course, not her real name. But she came to see me last week feeling very anxious and telling me that she's had a baby about 4 weeks ago, and that ever since she came home from the hospital, she's been feeling very, very anxious. She hasn't been sleeping at night. As you can imagine, the baby's been crying a lot, and she's not able to catch up on sleep during the day. She does not have any help at night, and so she cares for the baby by herself. Basically day and night. She has been doing that for 4 weeks, and she's been feeling a lot of anxiety, and recently she's had a couple panic attacks. Linda actually went to see her doctor the other day, and the doctor suggested prescribing an antidepressant medication and also an anti-anxiety medication. Linda was reluctant to take the medication. This is how and when she looked me up and she came to see me. When she came in, she looked pretty distraught, and she was obviously very anxious, and she said, "I don't want to take any medication right now because I'm breastfeeding, and this is the only way right now where I can feel that I'm being a good mom to my baby. I don't want to transfer the medication through breast milk." And she said that even though the doctor said that the quantities that were transferred or transmitted through breast milk were minute and negligible. So she said, "Can you help me at all, or do I have to go on medication?" And when I looked at Linda, she looked not just distraught, but very, very tired. When she was talking to me, she almost fell asleep mid-sentence. And I thought, this woman is so exhausted. Whether she takes medication or not, she first and foremost needs some sleep, and she needs to relax. So what we did in session was that Linda laid on my couch, and I guided her through some exercises. And what happened, lo and behold, was that Linda fell asleep right there on my couch in my office, and I let her sleep for about 20 minutes, which may seem like a long time, and it was not doing any major psychological work, of course, but I just realized that what she needed most of everything was to sleep. And when she woke up, she said she felt refreshed. She said she felt relaxed and not as anxious as she was when she first came in. And I thought, how do you feel about coming here on a regular basis and learning how to manage your anxiety? But also what I encouraged her to do was to get some help with the baby and get some respite so that she could catch up on her sleep. So a week has gone by. Linda came back. She had a long talk with her mother and her husband, and they decided together that she would express breast milk, and that the father of the baby was going to feed the baby one meal at night, late at night. And her mother would come in early at 5 o'clock or 5:30 to feed the baby another meal, so that for at least a few days Linda would be able to catch up on her sleep. "And how are you feeling today?" I asked Linda, and she said, "I feel like half my normal self again. I still have some anxiety, but a lot less." And I think this brought me to think again about the issue of medication during pregnancy and while women breastfeed. For some reason, doctors tend to prescribe very quickly when a woman complains about anxiety or a depressed mood. But sometimes it's not about medicating a woman, but it is about helping her to restore sleep, to restore confidence. After all, this is a major change, a major transition that women go through, and men as well. and they need a lot of support and help and practical help before we would even figure out if they need any medication or any other kind of help. So if you would like to read a little bit more about medication, the use of antidepressant medication during pregnancy and postpartum, please check out my blog down here. Thank you, and I'll see you again next week.